her leg, my hand comes around right underneath her knee. Okay, got it?
Mm-hmm.
All right. My top arm is going to come right across her PSISs. And in this position, notice where my hand is. Okay? Keep your hand like this or keep your hand like this. Don't keep your hand like this. Right? I didn't do it, but this professionalism, right? So, all right. You may not mean anything by it, but the patient might be like, why is her hand resting on mine? Right. Okay. So here we are. So I'm in this position. I want to stretch her hip flexors. I'm going to move her into hip extension. And so all I'm going to do now is just lift up. Just shift my body weight from my one leg to the other. And so I'll get her there to where she feels a little tension. And now I'll hold. Feel okay? Feels kind of good, doesn't it? Yeah? So I'll hold this. I can hold this for quite a while. So 30 to 60 seconds. Put her back down. If I don't stabilize, see what happens? How her pelvis can move? Or if she says, ooh, I really feel that in my low back, that should be, you know, the old alert thing. Don't want her to feel it here. We should be stabilizing right across her PSISs. In this position then, I will stretch her hip rotators as well. But here's a little mental gymnastics. When her foot goes in, what's happening to her femur? She's going into external rotation, but when she goes into external rotation, who's being stretched? Her internal rotators, right? So you can see how she's compensating. So we lock her in, and I take her here, and now I'm engaging the barrier, and she's being stretched. Okay? But if she's in external rotation, her internal rotators are being stretched. To do the opposite, I'll just bring her out here. There's my barrier. Take her right in there. Is that okay? Okay. So now her leg is in internal rotation. That means the external rotators are being stretched. Just like when we did this, shoulder flexion, the extenders were being stretched. No different. My wrist extensors are tight. Now they're being stretched. I'm in wrist flexion to stretch my extenders. Same principle applies. Okay? While she's here, we can move down to the knee, pillow or towel back underneath, and I can take her into knee flexion. I can make it easier on me and maybe do this if she's able to do that. But if she is an older client or not able to handle being on her tummy, I may have to do a sitting up technique. Okay? So to do that, have you go up and on the edge of the bed. And so now in this case, I can still use my pillow or my towel, and I'll come down here, scooch forward a little bit. Okay. And so now I can do knee flexion right here. I can hold her, count, do whatever. But this is one of my favorite places to integrate the active stretching, right? Great place. Say her quads are tight. I can have her start by pushing into me, push into me, isometric contraction of the quads, and now I say, okay, relax and pull that heel underneath you. Her hamstrings are contracting, sending a message up to the quads that say, relax quads, and I'm letting her go. And I'll say, excellent, push into me, push, isometric contraction, right? And then go ahead and pull back underneath, and letting her go. So it's a great place to integrate those active stretches, okay? And at the same time, I can be doing this. Usually I'll have my goniometer kind of lined up here. I'm like, okay, that's 97, 100. You know, we're just counting it out. And the patients, you know, they want to get better numbers too. Make sense? Okay, good. Let's scoot you back. Because the knee needs a little extra on your back. You're good. Knee extension. Remember with passive range of motion, we took one hand, placed it above the knee, other hand curled around. Remember how picky I was about that with you? Some of you were frustrated with that. But it's important now because as we go to stretch, we come up, we can give just that slight little bit of external rotation for the what? Screw home mechanism. So here I am. I can take her right up. Does it feel okay? I can stay here a long time. Much easier than this. Can't control that very well this way. So you just hold, stabilize, and away you go. Okay. Ankle, passive range of motion with a plus. Take it to the end, engage. Take it to the end and engage. Same thing with dorsiflexion and plantar flexion. Remember, with dorsiflexion, can I slip off your shoe? Okay. So with dorsiflexion, we grabbed a hold of the heel and stabilized. Well, now I'm just going to take it to the end and plus. Feels all right? For plantar flexion, we still kept that same position on the heel, but we took it down. Now, with plantar flexion, passive range of motion, we said you might do this, now you must do this, right? So we'll grab the heel, and now we'll really push that into plantar flexion. Our toes, if they need to, they're no different than the fingers. Ooh, a little pop. So we would stretch them individually, just like we did with the hand. Questions? Okay. Good.